If you have high LDL and your doctor has told you to try nutritional interventions and you still have high LDL, which most people still do because nutritional interventions don't really change things dramatically, I'm going to show you a bunch of other reasons why your LDL might not be going down. The biggest mistake people make is assuming that their diet is their main lever for lowering your LDL. You have to think about secondary causes. By the end of this video, we're going to go over the 3 medications that may be secretly ruining your labs, as well as undiagnosed endocrine dysfunction and silent metabolic filtration issues, so you can take charge over your LDL. You're going to have a diagnostic audit to learn about metabolic conditions that are spiking your cholesterol, the drug trap that I mentioned, and an action plan that you can bring to your doctor to try to figure out how to get things optimized. I'm Dr. Huck, and I'm here to give you evidence-based insights without any fluff, just the facts, to help you empower yourself to make good health decisions. Check out my newsletter, medicalwisdom.org, for full references and deeper dives. The reason LDL matters is because we know the longer you're exposed to high LDL, the more your arteries are going to clog up. These LDL particles get into your artery walls, they cause plaque, and they restrict blood flow, and eventually you have a heart attack. LDL is the key thing you want to think about when you're trying to assess how much danger you're in when you look at your labs. So let's jump into metabolic drivers of high LDL. This can be things like liver, thyroid, pancreas, kidneys, and adipose tissue, or gaining weight. So the first thing is your thyroid, which people often will get checked every now and then when they go in for a physical. But thyroid hormone is really interesting. It's going to build these receptors that clear the LDL from your blood. So when your thyroid's not working as much, you're going to have more LDL circulating in your blood. So if your thyroid's low, especially, you could have a 50% difference in the clearance rate of LDL. So you want to have the TSH checked, as well as follow-up hormones. Next, consider what's going on with your liver. High liver enzymes are showing active damage to liver cells. But you also have to consider biliary obstruction from the bile ducts, for example, gallstones. When your bile system and your liver are not connected up well, lipoprotein particles are going to flow back into the blood. So always look deeper into what's going on with your bile and liver system, because you could have a reversible cause of high LDL. Next, consider what's going on with your kidneys. Kidney dysfunction is going to decrease the activity of enzymes that are breaking down the lipoproteins, and therefore the LDL is going to stay in the blood longer and you're going to have higher levels. There's something called nephrotic syndrome, where proteins are leaking out of the blood, and the liver is going to overcompensate by making more LDL and VLDL. So get a good picture of what's going on with your kidneys, your GFR, your filtration rate, because if you can fix that, you can also sometimes fix your LDL. Now, this is probably one of the most common causes. When you have high insulin and when you're pre-diabetic or diabetic, there's a totally independent mechanism by which LDL is going to go up, particularly the small, dense LDL. So what if your LDL is just barely above normal, like 110? You might actually have a much higher disease burden because a lot of that LDL might be the small, dense LDL particles. And these are the particles that are more prone to oxidation. They create more inflammation. They're going to stick to the artery wall more, and you're going to have faster plaque buildup. You're going to have a faster buildup of that calcification of the arteries. And you can tell if you're having insulin resistance by just getting your insulin hormone level checked. This is different from your A1C, your hemoglobin A1C, which is what your primary care doctor will check to see if you have diabetes or prediabetes. Before you have diabetes or prediabetes, your insulin will be high. That's a pre-diabetes, and that's when you have insulin resistance. And when that insulin resistance is starting, that's when you're going to have a dangerous change in the dense, small LDL particles. So you can be having damage even when your LDL is not dramatically high. Think of it as a crime rate in a city. You can have a crime rate that's not so high compared to other cities, but if almost all of them or a disproportionate amount of them are murders, rapes, and things like that, it's much more dangerous than it looks. So consider obesity, because obesity and insulin resistance go together. And that's why your doctor will probably tell you to lose weight when you have a high LDL. However, you don't want to lose weight too fast, because what happens is people eventually go on a very low calorie diet, like 1,000 calories a day, and then they lose weight really fast. And what happens, as those fat cells shrink, they're going to dump all of their stored cholesterol into the bloodstream. So you're going to have this temporary spike of LDL. So you might be getting your cholesterol numbers checked after you're losing weight really fast. And you might notice your LDL has gone up. That's just because your liver has become overwhelmed by the fat cells dumping all that cholesterol into the bloodstream. So you want to wait at least 3 months after your weight has stabilized before you really trust your lab results. A similar mystery is people who are not overweight, but are what are called lean mass hyperresponders. These are lean people who are on a ketogenic diet who often see very, very high LDL spikes in the 300s, 400s. And it's a mystery. Why is that happening? Well, what happens is the body has turned to using LDL as a fuel transporter to the organs. And right now, the ketogenic diet is understood to burn fat disproportionately, but this sudden spike in LDL can often be related to being on a ketogenic diet in these types of populations. So keep that in mind too. Look at your overall weight and your overall nutritional plan to interpret your LDL more accurately. In addition, there's a syndrome called Cushing syndrome. It's somewhat rare, but it's often undetected. It's when you have high cortisol. You could be under extreme stress for a long time. You could also have high cortisol from that. And this is another way in which cortisol, when it goes up, increases LDL. So your adrenal gland is secreting more cortisol. That's making your liver produce VLDL and making your fat tissue mobilize fatty acids. And that's going to increase your LDL in your bloodstream, which is what we detect when we do a blood test. This is all independent of your nutritional choices too. And the person will tend to have a gut, visceral adipose tissue, central obesity. That's the key thing that you can see in Cushing's syndrome. So you have to interpret that LDL in the context of the overall picture of what's going on in the person's body. Another interesting case is especially young women who are struggling with anorexia nervosa. They're starving, and paradoxically, this malnutrition can lead to higher LDL. And what that's about is a protective adaptation in the body to protect the body from this starvation mode. So when somebody is starving, living on 500 calories a day, bile production from the liver and the gallbladder is lowered. So the cholesterol is not as efficiently produced or excreted. And your body's going to respond by decreasing its breakdown of the LDL at the cellular level. And then as an adaptation, there's a metabolic shift, essentially conserving energy. And the net result is increasing the LDL in the bloodstream. So high LDL, look at the person and think, well, is this someone who could be having Cushing's disease or anorexia? That's another explanation. And if you can fix the underlying cause, you can actually fix the LDL issue. Now, what about medications? There's a lot of medications that mess with your LDL. First of all, steroids, glucocorticoids, prednisone. Many people have to go on prednisone when they have an infection or if they have an autoimmune issue. Long-term use of steroids can definitely block these LDL receptor clearance mechanisms, and you can increase your LDL by 10 or 20%. So you have to consider what medicines you're on, specifically glucocorticoids, steroids, prednisone, that kind of thing. In addition, many people are on antipsychotics and antidepressants. These often don't directly affect LDL, but what they do is they shift the body towards insulin resistance, diabetes, and obesity. And these are the things that will then cause the LDL to go up. So weight gain can be the indirect mechanism. So think about antidepressants as well as antipsychotics, Abilify, olanzapine, risperidone, but even regular SSRIs, serotonin medications for depression. They all have weight gain linked to them in varying degrees. You might have high blood pressure and your doctor might have given you a thiazide diuretic like hydrochlorothiazide to decrease your blood pressure. Through a complicated mechanism in the kidney, the way this is processed can sometimes raise the LDL. So you want to think about, are you on one of these types of blood pressure medicines too? You might want to be on a different one that doesn't have this effect on your LDL. Finally, if a woman is pregnant, we know that there is a rise in LDL in the second and third trimesters. This is actually providing the building blocks for the baby's brain because of the cholesterol that's needed to create a neuronal network, as well as the placenta's hormones. This is considered healthy and physiological as an adaptation. It's not a disease state, but it could be something that somebody notices, a woman who goes to her OB-GYN and says, wow, look at my labs right now. All of a sudden my LDL went up. So you need to have this context as well. How about menopause? We see many postmenopausal women who have higher LDL. When estrogen is high and normally functioning, it's going to increase the receptors of LDL on the liver cells, and then the LDL level in the blood is going to go down. However, we know during menopause, estrogen levels drop. So those receptors are not as numerous, and therefore the LDL levels in the blood go up. Basically, LDL clearance goes down or slows down, even if the person doesn't change her diet. So she might say, my weight hasn't gone up, but my LDL is now high. We know that menopause is a risk factor for increased cardiovascular disease, and this is one of those mechanisms. Another mechanism is probably more visceral fat, which is inflammatory fat. So keep that context in mind too for any women who are in the perimenopausal or postmenopausal stage. In summary, a high LDL is a clinical clue. It's not a diagnosis. It's like chest pain. You have a symptom, you have a marker. So you have to look at the whole person. If your labs don't match your lifestyle, you aren't necessarily failing. If you're eating salads and you're eating lean meats and everything's great, you might be just missing one of these variables. So I'm going to share my LDL diagnostic action plan, how I like to think about this. So first of all, we want to get comprehensive blood work that looks at all of these things that I mentioned: your thyroid, your liver, your gallbladder, fasting insulin specifically. Your primary care doctor probably doesn't order fasting insulin, but fasting insulin is one of the best things that you can get to track over time to make sure that even if you're losing weight or you're changing your nutritional plan, you want to see that fasting insulin go down. Next, you want to think about weight stability. Remember, if you're losing weight actively, the LDL is not going to be as accurate. You want to retest after a stable period of about 3 months and avoid testing during any acute illness, which is tough in the winter when you're going through all these viruses. I like to do a really good medication audit, looking through all the medicines that could affect LDL, thinking about this lipid tax, steroids, diuretics, and others as well, antidepressants, antipsychotics. So think about your medications carefully. I hope this has been helpful. If you want to learn more, check out this other video here. Feel free to join my free newsletter where I provide full references as well as more deeper dives and give my own personal approach to some of these issues. Take care.